One's level of education is the best predictor of health. That is, the more education one has, the more likely that person is to be healthy. It is estimated that in the United States, lack of a high school education is responsible for 245,000 deaths per year. On the flip side, health also influences educational achievement, especially for young children. Chronic illness, disability, hunger, physical inactivity, obesity, and other health factors are linked to poor grades and lower educational attainment. Education is one of the most powerful public health interventions that we have, and good health is one of the best educational interventions. We're going to focus on this tight link between health and education on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to focus on the importance of education to the overall health of Minnesotans and the impact that health has on academic achievement. We'll also be talking about efforts underway to improve the overall quality of Minnesota's educational system and to reduce the disparities in educational outcomes that exist in the state. Joining me in this discussion is Dr. Brenda Casselius, Education Commissioner for the state of Minnesota. Brenda, welcome to the program.
Thanks, Ed. Great to be here.
It's always nice to have a fellow commissioner on talking about things because as we work at the state level, I'm finding that your issues are also my issues, and I'm hoping in our discussion that we realize that my issues are also your issues, that health and education are really linked.
They are absolutely linked, and I think that's why the governor in his wisdom has set up the Children's Cabinet with you, myself, and Lucinda really working together to work with our agencies to focus on children's issues because we are so linked.
Right. And I want to kind of focus on the importance of education on a whole variety of areas in our state. And I want to point out two kind of facts. I got a couple of slides here, and I'm going to put them up really quickly to point out some of the things. The first slide shows that as you increase your educational achievement, death rates go down. If you have less than a high school education, your death rates are higher for both men and women. And you can see on this slide, as you get more up to postgraduate education, your death rates go down, both men and women, for all-cause mortality and for almost any kind of things. So education really impacts health. The second slide, I think, is also pretty dramatic. It shows that as on the left is the unemployment rate, and on the right is average income. And as you go up the scale from less than a high school diploma up to a doctoral degree, you can see your chances of being unemployed and your chances of having a higher income really increase dramatically. So what do these two slides tell you? As Commissioner of Education, that education certainly is linked to longevity, and education is linked to employment and income. What does this tell you?
Well, what it says is that, one, you have to have a really solid education to be a great citizen, to really participate in a whole community, and to be able to thrive in life. And part of that is really being healthy and really being able to take healthy choices and make healthy choices and get your education early. And it's not just children, but it's also parents and parents working with children and being in a whole community coming around education. And so if you're going to really want great outcomes for yourself and for your family, you have to put in that little bit of effort around education and really be able to get what you need there.
Yeah. So it would seem to me that education affects all parts of our life. Are you sensing that everybody in Minnesota is really supportive of our educational system, that they really want us to invest in education?
Yeah, that's one of the things that I have found as I've started to go around the state is that people really are invested in education in this state. Everybody cares deeply. Sometimes I think you hear that people want to blame parents and say, oh, parents aren't involved enough, and parents were just more involved with their kids than we, somehow that would be the silver bullet. But all parents love their children. All parents want the best for their children. What I think is happening is that there's a lack of opportunity, I think, for some of our parents and some of our children. And that happens really early in life. And so it's really hard to catch up later and then present these opportunities so that they're getting this greater attainment to, say, a bachelor's and a master's and a doctoral degree. You know, and every single time you get more and more degrees, you've seen by your chart, you make more money, you have greater opportunity, you're better connected within your community, and you thrive more. And then you are able to present those opportunities to your children. And so this is just so woven together, your education and your opportunity.
Now, you know, as you mentioned, talking about parents, a lot of the influences on education are really right from birth on.
Yeah.
And most people assume that, well, the school system really kicks in at pre-kindergarten or kindergarten, but my understanding is that you're involved really right from birth.
You know, it's startling. There's a new study out, and it's startling, the statistics showing Minnesota. I mean, in Minnesota, we kind of think, oh yeah, we're doing okay. Everybody's kind of doing okay. But we have about 20% of our students that are now in poverty overall in elementary school. And what's even more startling, Ed, is that when you look at those statistics, we have about 15 to 20% of our students who are actually born into poverty. And if you break that out by racial ethnic group, 60% of our Native students are born into poverty. 44% of our African American students born into poverty. 33% of our Hispanic students born into poverty, compared to 8% of white students. So already, you know, there's no choice for these children. They're actually born into a situation that presents a lack of opportunity for them.
So how do you deal with that? And how do you deal with some of the early childhood things like poor housing and poor diet that really, as I mentioned on my introduction, some of these things really influence health. Are you involved in those? And what about, you know, sort of the 0 to 3 age period, that reading is so important, to read to your kids is so important. How are you interfacing with families and communities with this kind of thing?
So we do several things. We have wonderful ECFE programs that work with families, early childhood family education, and parents can join. Unfortunately, we don't have a lot of diversity in our early childhood family education programs. We want to be able to increase that opportunity and get the word out that we have these programs for parents and families to learn about how to read to your children, to learn about health disparities, to learn about how to good nutrition for your family and for children, and also those milestones that children have to meet, so that you know if something's not quite right, you can get the support that you need right away. And so I think that that's one way. Head Start is another way. Preschool, early childhood, working with your local school districts so that you're getting the right kind of screenings for children early on. But that really early childhood piece is a key factor for families. And childcare can be expensive. So we want to make sure children are getting into high quality childcare, that they have those opportunities that are actually preparing them for kindergarten, because if they get behind already in kindergarten, very, very difficult to catch them up.
Is this something that the Children's Cabinet might be looking at as we, you know, work with Department of Human Services and Education and Health? Because you're saying a lot of these things are social services, health, education.
You know, one example is the home visits that you all do and the health screening, and then DHS and the support that they give with childcare, and then the department working with the ECFE program and Head Start. So we all have different programs within our agency, and so coordinating those and aligning those to better target and strategically work with families, I think is absolutely essential.
Does the federal government, with a lot of these programs that we hear about, you know, No Child Left Behind, Race to the Top, do they also focus a lot on early childhood activities, or are they focused mostly on the K-12 kind of curriculum?
Well, the focus historically has been mostly K-12, but there has been a new focus from this president and the secretary on early learning and early childhood. A new office just opened up at the Federal Department of Education called the Office of Early Learning. We also opened up an Office of Early Learning at the State Department of Education. I don't know if they're copying us or if we just got hint that that was a good way to go, but you know, really, really important issue to focus on.
So what are the things, as you see kids coming into school at whatever age, you know, in sort of the pre-K, kindergarten, first grade, what do you see the things that really help them to be good learners, and what do you see as some of the things that might hinder their actually learning?
Well, James Comer, a renowned psychologist, said no great learning happens outside of a significant relationship. And so you want to make sure that kids have the social emotional skill sets and they know how to build peer-to-peer relationships, peer-adult relationships, and that those are really healthy, that they're able to manage healthy conflict. Because when you are faced with problems and you don't understand maybe something that's presented, you want children to be able to work through that in a healthy way rather than just give up. So that's a big part of kindergarten readiness. The other one is really language skills, literacy skills, numeration, being able to have those kind of concrete academic skills. But a big piece of a children's success in kindergarten is, can they build relationships? Can they work with their peers and adults?
Good. Well, I want to talk about some of the health things, since this is a public health show. I want to talk about some of the health issues that affect grades. But first, we need to take a little break.
Great, thanks.
We'll be back right after this message.
When life's this hard, graduating can be even harder. But you can help Ativa and the students in your community make it through by visiting boostup.org.
Welcome back. We're talking about the link between education and health with Commissioner Brenda Casselius, who's the Commissioner of Education in Minnesota. Brenda, I want to talk a little bit about some of the things that we deal with on the health side, but also we know that impact education. And I've got 3 slides that I want to go through real quickly that look at the students who are A students, sort of their behaviors compared to those who are D and F students and their behaviors. And the first slide looks at alcohol. And if you look at the slide on the left, people who get A's and B's, they don't use alcohol as much as the students who do on the right, which are D's, C's, D's, and F's. So the poorer your grades, more likely you are to use alcohol. The next slide looks at physical activity. And again, the same pattern holds. On the left, the A students are more physically active than the C, D, and F students. They're less physically active. And then the third slide shows, drinking soda pop, sugar sweetened beverages. Students who are A and B students don't drink soda pop as often as the C, D, and F students. And this pattern holds for a whole variety of things. These are just some examples. If you look at almost every health behavior, every risk factor, the same thing holds. How are alcohol and physical activity and soda pop consumption linked to grades?
Well, we are chemical beings, right? And so all of our energy and the way that we think and our brain development is critical to what we put in our bodies, how we take care of our bodies, and really how our attention is to that academic environment. And this really starts at birth. You've heard fetal alcohol syndrome with children whose parents are making poor choices during the time when they're born and after when they're in the home real early on with the brain development. And we know from birth to 2, this is this critical time of development, and then birth to 5 even more so that continues. And so really you want to make sure that you're putting in good nutrients, you're getting your vegetables, you're getting your fruits, you're getting good healthy activity, and obviously if you're using drugs or marijuana or alcohol or other thing, that's going to impact how you think and your ability to process information. And so, it only makes sense that these statistics look this way. So you really want a well-rounded, healthy child to be able to educate them in a way that maximizes their ability to learn.
Yeah. So how do you deal with these issues, these kind of lifestyle choice issues, these behavior issues, as an educational system?
Well, we do a lot of things. One is we have health classes in schools.
So is health education
Yeah.
mandated in most of the schools?
Well, it's not an actual credit required for middle school, but it is in high school.
Okay.
You have to have some PE and health in high school, but it's not enough.
Right.
So we do other things. We have clinics. We also, a lot of our children are involved in athletics, and there are certain requirements to be an athlete in school. So you have to keep your grades up. You have to stay off of drugs. You can't be using alcohol and drugs for that. So there's these other incentives for children when they get to be high school students.
Mm-hmm. How about school nurses? I know in the past
Yeah.
every school had a nurse, but I know that budget things have cut down, and I know when I was working in the Minneapolis Health Department and did school-based clinics, there are a lot of schools had to share a nurse. And
Yeah.
where are we with that?
Well, Minnesota's pretty good with its school nurses. We're lousy with our counselors. We need more counselors, which are the other end of really with
Yeah,
the
the mental
development.
health,
Yeah,
right.
the mental health piece or the health piece, the pieces around alcohol use and intervention for depression and that kind of thing. So we don't do well with counselors. Most schools have a nurse or like you said, share a nurse, but still not enough. Every school ought to have a nurse. Every school ought to have a counselor. And these are just basic things for a good wellness and a good healthy environment for children.
Yeah. Speaking of the environment, what about the food service? I know a lot of kids are on free and reduced lunch, and there's some requirements for that. But what do you do in the school system in terms of making sure that kids get a good breakfast, a good lunch that is well-rounded?
Well, we have lunch programs, and certainly pizza is not a vegetable. So if you're following the local, not local, but the more recent news, but I do think that things like soda pop, we've taken out vending machines in schools and that kind of thing, so that there's healthy snacks for kids in schools at the high school level. But I think that really what we have to do is have really great policies around, and I know that Mrs. Obama is doing some work at the national level with that. Some policies have been changing around that. The governor is supporting Farm to School initiative. We do a school breakfast initiative for universal free breakfast for schools that have over 40% poverty. And so we're doing a lot of things to make sure that students are they're eating healthy as part of their daily intake.
What kind of partnerships do you have throughout the state, to deal with, like farm to school? You got agriculture and chemical dependency. You've got the treatment programs, the prevention programs. How do you interface with those, and how do you collaborate with all of the partners throughout the state?
Yeah, so I meet with them and meet with our superintendents, and we talk with them as well about that, meet with our nursing group and other partners, and like you, meeting with you and the Children's Cabinet, setting our priorities and making sure that we're paying attention to not only what's coming out in our statistics, and we do surveys on healthy behaviors and look at that. We look at assets with kids and how well they're doing with their asset building and kind of on the strength side of things rather than just the deficit side of things. So really trying to coordinate that work together and align it so that it makes sense and it's easy for parents to understand. Because sometimes, this is a lot to take in: academics, health, social emotional stuff, and especially when they move into their preteen, teen years, and kids are making their own choices more than a healthy choice that a parent might make for them. So it's kind of, you don't want to pull off at that time as a parent, you want to actually help. One really interesting statistic too, that out of all the National Merit Scholars, there was a study done a few years ago, the one thing they had in common was that they ate a healthy meal with their parents at night as a family. That was the only thing National Merit Scholars had in common.
Good. Hey,
so have a meal
homes are important. Nutrition
Yes.
is important. Time to really sit and talk with your parents is important.
Absolutely.
Good. Well, I'm going to talk about some of the disparities next, but first we need to take another little break.
Okay, great.
And we'll be back right after this message.
Learning how to kickflip 6 stairs takes determination. So will getting into college. I've got what it takes. So do you.
Welcome back. We're talking about education in Minnesota and its link to health and healthy development with Brenda Casselius, Commissioner of Education. Brenda, I want to again show a couple of slides that are, to me, somewhat disturbing, and I admit that I kind of picked and chose some to make the point. But the first slide shows a map of the United States and how well students are doing in 4th grade reading. This is just a couple of years ago, and if you look at Minnesota up there in the very top, for all overall students, we're one of the top 10 states for 4th grade reading for all students. So, we're really doing well. But then the second slide shows this same kind of 4th grade reading level at above or proficient for African American students, and we're at the bottom, 10. How can we have such disparities in a state like Minnesota, where everybody's above average, and that we do a lot of investment, we invest a lot in education? What's going on? What's behind some of these disparities, and what can we do about those?
Well, we're actually slipping in reading, which is really, overall, which is really disappointing. We score very high in math. We're second in the nation in math. But again, you turn that upside down for black students or for our poor students, and we're actually the worst in the nation. And so you're right, it is unacceptable, and it's just very discouraging. We have great teachers, we have great schools, and a lot of really good stuff going on. But what we're lacking is really the resources and the right kind of support to meet the needs of the individual learner. So many of our kids come to us uniquely qualified, I like to say. And I mean, we're in the human development business, and no one of us is the same. So we can't continue to do business like we've always done business. And so I think that there's a lot of things we need to do. We need to start earlier and really get kids these opportunities. It's absolutely essential that we close that gap much earlier than we're actually doing with early childhood, high quality early childhood, getting them ready for kindergarten and making sure that it's all-day kindergarten. We don't want to lose ground there. Making sure every child is reading at 3rd grade. So many of our children are not reading at grade level on 3rd grade, and then it's very difficult for them because after that you start reading for content and knowledge. And so you're not just reading to learn to read, you're learning, you're reading to learn then afterward. And so it's absolutely important. So
are these disparities?
They're linked to all the other stuff.
Are they linked? Are they income related?
Yeah.
Are they race related? Are they geography related? Are they parenting related? What?
It's very complex because it's all related. I mean, sometimes you just get an ineffective teacher, right? Sometimes you just didn't have a good teacher. Sometimes it's because you didn't have good preschool and you came not even speaking. Sometimes it's because you don't speak English. Sometimes it's because you have a disability. Sometimes it's because you maybe learn in a different kind of unique way, or it's very complex. Or maybe because your parents, aren't helping you read at home, or maybe because you are in a situation where education isn't valued. I mean, you could name 150 different reasons on why it is, and that's why you need 150 solutions to meet the needs of that unique kid who comes to you. And I think as we've raised class size in Minnesota, and as we've looked and not focused on giving teachers the tools and the right tools, that's really what's hindered us. So that's the building of that toolkit for teachers that they have to have. It's not that they don't come wanting to make a difference for every single kid, but think if you're a secondary middle school teacher, you got a kid who's not reading on grade level, maybe it's an 8th grader, but he's reading at 5th grade, and he hasn't had the right interventions. Now you get him, but you also have 35 kids, 10 of them are special ed. You have about 3 or 4 who don't speak English. You're in this classroom by yourself, and then you get another class of the same 35, and all day long, 6 classes, 180 kids, and you're supposed to give them the individual attention that they need and try to catch every single one of them up. So what we've done is try to get schools to work in teams, especially at middle school, and do a lot more intervention at the middle school level if kids don't come ready. So that's why I said we've got to get them coming ready, right? And so you get your high school teachers say, well, they didn't come ready in middle school. You get your middle school teachers say, well, they didn't do their job in elementary. You get your elementary teachers who say, well, they didn't get reading by 3rd grade. And then you get your 3rd grade teacher saying, well, they didn't do it in kindergarten. And then you get your kindergarten teacher saying, well, the parents didn't do it. But you don't want to blame and point. You you want people to come together and work.
Are other states doing better than we are?
They are.
And
yeah.
what are they doing differently? Can we learn from other states?
Well, other states are really putting a focus on those disparities, and they're really putting a focus on reading coaches. We just made an investment in reading this year, so we are going to put a huge focus on third grade reading. We have an investment with the Reading Corps, which are like a AmeriCorps program where reading coaches come in and work with kids. We've put an investment on early scholarships. Some states do universal kindergarten. They start school at kindergarten all day. Some states are doing a universal preschool. So 3 and 4-year-olds get all day high quality childcare. They link it to high quality. They make sure that they have standards at preschool level. So this isn't just time where kids are going and sitting and they're actually very deliberate and strategic about getting them the language development skills, making sure that they have the social nurturing that they need to be able to do well, about that relationship piece I was talking about earlier. And so, yeah, other states are ahead of us on this in the curve, and that's kind of why we see the slippage now. You know, we're not going to stay number one if we don't start really looking at it. Plus, Ed, a really thing that I think people should know is that right now, under the age of 18, 1 out of every 3 children is a children of color. And so, you know, when you have 30% of your kids now being children of color and we're leaving 50% behind, it is a moral imperative that we do something about this now. We can't wait any longer, and it's also an economic one for us, our viability in Minnesota. Right.
Well, it certainly highlights the fact that education is crucial for the success of our state in so many ways.
Absolutely.
Economically and health-wise, and certainly just education is just central.
It is.
So, Brenda, thank you for being with us. We covered
so
a lot
much.
of ground, still a lot to talk about.
Yeah,
Thanks for the work that you're doing.
Thank you very much for what you do as well.
And I'll be back with a closing comment right after this message.
When you earn your GED diploma, the barriers in your life fall. Take the first step and get free GED information in your area at 1-877-38-YOUR-GED or yourged.org. Earn your GED diploma and begin your brighter future.
On the wall at the entrance to the health service at the University of Minnesota is this quotation from Herophilus of Chalcedon, who was the physician to Alexander the Great. He said, quote, "When health is absent, wisdom cannot reveal itself, art cannot become manifest, strength cannot fight, wealth becomes useless, and intelligence cannot be applied," end quote. This quotation highlights the fact that health is central to and essential for a good education, which allows wisdom and intelligence to flourish. It also underscores the fact that health is of critical importance for most every other aspect of our society that makes our lives meaningful. As we learn more about the importance of education to our health and development, a reciprocal quotation should have been penned by Herophilus. It could have gone like this, quote, "When education is absent, health cannot flourish, lives cannot be long, disability cannot be avoided, potential cannot be realized, and contentment cannot be achieved," end quote. Health and education are like the yin-yang symbol. Both the yin and the yang, both health and education, are of equal importance, and they are interconnected and interdependent. Both are essential to form a full circle of life. The bottom line is, if we want to have a healthy society, we need to be sure everyone is well educated. And if we want a well-educated society, we need to be sure everyone is healthy. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.